Thank you for joining us again today with our Medicare education series on all the different topics in Medicare. Affordable Medicare Solutions is the largest provider of education services in Georgia for Medicare programs. And we have a staff of 9 people, soon to be 10, and we're in Suwanee, Georgia. We serve the entire state of Georgia, and all of the services we provide are free to you, including enrollments, annual reviews, and other services. And one of the main services that we provide is assisting people with the difficult decisions during enrollment periods. And there's a variety of enrollment periods, so that's the topic today. So let's get started and check it out. Medicare enrollment periods. So when Medicare was started, the intent was to have a single enrollment period into Medicare. And that was in the 1960s. And they said, look, when people turn 65 years old and they've been working or their spouse has been working for 10 years, we're going to give them Medicare for free for the hospitalization portion of Medicare. And that was the original intent. And then there's a charge for the outpatient portion of Medicare. Now, that changed soon thereafter because some people raised their hand and said, hey, wait a minute, Bob got hurt. He's working at the factory and he's only 57 years old. He's got to have some health care because he's now disabled. So they created a new second type of eligibility into Medicare where you can enroll prior to age 65 for those people who receive Social Security disability income. And that generally has a 24-month wait. Once you receive your first income check, 24-month wait. Now that's kind of strange because the third period had to be created because some people aren't even going to live 24 months because of their disability, or they need health care right away in order to make it more than 24 months. And a great example of that is end-stage renal disease. If you don't receive dialysis, you will die. So they provide Medicare generally after about 4 months, your 4th month of receiving dialysis. Or even some other things now, such as Lou Gehrig's disease, which is called ALS, or other disorders they're now looking at making them receive the Medicare prior to the 24-month window if they're disabled. So that's your original eligibility to enroll into Medicare. But there are now enrollment periods beyond that initial choice of getting Medicare, Medicare being assigned to you or you asking for Medicare. So there's 4 different categories that we deal with, and the consumer generally only knows about the initial election period. The initial election period, if you're not disabled, is if you are turning 65. You have 3 months prior to your birthday month. Then you have your birthday month and 3 months after your birthday month. That's seven months total to be able to choose your enrollment into Medicare. Now that's for most everybody, right? However, those people who do not use that initial election period can use the next election period, which is called a special election. A special election might mean that you were working beyond age 65. You're 68 years old and you decide to retire. Well, that's a special election because you're going to lose your group health insurance. That's under group health insurance, you would generally call these things qualifying events because there's other things that fall under special elections. And we're going to go over that in an upcoming screen. The next thing is an annual election. Everybody who's already in Medicare gets to use the annual review period, October 15th to December 7th. And that's where you get to review your plan to make sure that it's okay for the upcoming year. And then the last period is called the Advantage election period. And the 4th period was created in 2019 because people who are in the programs that have doctor networks like HMO or PPO doctor networks sometimes found out in January, February, or March, oh no, my doctor or my hospital is not in my plan anymore. And so they get a one-time mulligan to fix their plan during the 1st quarter of each year. That's the Advantage election period. Doesn't apply to people who are in traditional or original Medicare. If you are a special needs person, which means you have low income or chronic illness, you can also make changes throughout the entire year, one time per quarter. We're going to go over that in greater detail. So these special election periods, when you're having a qualifying event, a special election outside of the norm, here's some good examples of that. And there are many examples, 2 pages worth. We're not going to go over all those today, but let's look at 4. The first most common one is, I'm leaving my job. I'm losing my group health insurance. I need to activate my Medicare. Do not activate COBRA if you're over 65 because Medicare is primary. If you have a spouse that's dependent upon the COBRA, that spouse can do spouse-only COBRA while you'll go into regular Medicare and make other Medicare plan choices. Now, the second one on the screen is a great example. If someone is moving, oftentimes people retire and they move from their house to the beach or they move to the mountains. They go to their retirement community. Moving is a great time to manage your Medicare because as you move from county to county or state to state, you can manage and change your Medicare options. Now, the third one is a special life event. A special life event can be, hey, I'm getting married, or I'm getting or losing Medicaid. Sometimes people gain Medicaid, sometimes they lose it. That's a low-income federal program for healthcare. Maybe you're getting divorced. Maybe you're losing your spouse's insurance through their retirement, and now you need to activate your own personal plans. Getting divorced or married can create these options. How about low income and special needs? This is the 4th category, and this is becoming very common. Medicare knows that low income people often have low health outcomes. So they design special programs to give them extra benefits and extra attention to help them. So those special needs programs are available throughout the entire year. So if someone qualifies in June because they've lost most of their income or spent their assets down, they can then manage their Medicare into a new program. Also, chronically ill people focusing on diabetes, heart, lung, and kidney problems. Those chronic illness plans are also available to help give those people special attention, and they can change one time per quarter all year long. So let's look at an applicable scenario to make sense of this. And a good one is the moving scenario. We've got Grandpa Ted. Grandpa Ted is living in Florida, loving it. He's retired down there. And then all of a sudden, Grandpa Ted has a life event with health, such as a stroke or cancer. And so he's got declining health, and his family said, hey, we want you to come move here to Georgia to be near the family. Grandpa said, okay, I'm going to move up and I'm going to not live with my family. I'm going to go to an assisted living facility. And he goes there, and the assisted living facility is trying to help him out, innocently thinks they're giving him good advice, but they're not, because they're not Medicare agents. They're assisted living people. They know about assisted living facilities, not Medicare. And they incorrectly tell him, just cancel that plan from Florida. We'll help you out and get you a new plan in Georgia. So he does it wrong. He loses some Medicare rights that were available to him, and he can't properly use his special election period, SEP, to be guaranteed into the exactly right program that he needs. It was an inadvertent, innocent mistake. Happens all the time. Grandpa Ted should have instead called a professional Medicare agent, such as Affordable Medicare Solutions, for free service. We're experts in this matter, and we would have helped him to be guaranteed the proper coverage so that he doesn't have to answer health questions, because remember, he had declining health. He had a stroke or he had cancer, and we don't want to answer health questions during this scenario. So if we do it right, it's smooth sailing for him. So if he would report his move properly to Social Security, then get guaranteed properly into the right plan and get guaranteed to have the proper service annually from a professional Medicare agent, he's going to be much better suited. This happens all the time. Millions of seniors are moving. Millions of seniors are also having other life events. And it's great to use a professional agency such as Affordable Medicare Solutions and all of our staff members to make sure that you're not losing your rights under Medicare. So thank you very much for joining us today. Our number is 770-945-5261. And we're available Monday through Friday, 8:30 till 5:30 p.m. Eastern Standard Time. If you need to have an appointment after hours or on the weekends, just let us know. And also, we do this same Medicare education in public. So just let us know if you'd like us to come to your church or your senior center, and we'd be happy to help you out. Thank you very much.